colleagues joining us from Ghana. The Africa Digital Rights Hub, in collaboration with the Open Institute, is organizing this webinar under the theme Data for Equal Development as part of the Open Data Day, which is also today. We are not just fighting a pandemic, we are fighting an infodemic. This is the word of the World Health Organization's Director General at the 2020 Munich Security Conference. With the right data, individuals, organizations, and governments can make informed decisions, keep people safer, and revive economies. Data is no doubt a vital key to helping us all get back to the semblance of normality after COVID. Our discussion today will therefore focus on whether COVID-19 data should be made open or kept closed at the international level, and what that will mean for access and use of such data in countries in Africa. We will also explore the implications, what the implications are for Africa's equitable access to crucial data, to treatments and vaccines. The discussion will also examine some of the issues that arise out of using Restore Data Rights Declaration within the context of opening and access to such data. Today, we will be joined by eminent panelists, and I'm very excited that we have them here. We'll be joined by Mr. Omar Seidu, who is the head of demographic and statistics, as well as coordinator for data, or coordinator of data for SDGs in Ghana. Mr. Omar, welcome. We will also be joined by Mr. Wole Ademola Adewole. I hope I'm pronouncing your name right. Who is the implementation coordinator for Flow Minder Corp Foundation, and then Mr. Gachara Irura, who is the project manager for Open Institute. Gentlemen, welcome to this evening's webinar. And at this point, I will just give you all a brief opportunity to give us opening remarks. Tell us a bit more about yourselves and your institutions, and why you think celebrating this day under this theme is important. I will start with you, Uma, if you are still here with us.
Thank you very much, Becky, and thank you, colleagues, for this opportunity. I'm Omar Seidu with the Ghana Statistical Service. I head the demographic statistics unit of the Statistical Service, and I coordinate data for the Sustainable Development Goals in Ghana. The Ghana Statistical Service is the national statistical institution with the mandate to coordinate and provide leadership in the collection, compilation, analysis, publication, dissemination, and use of statistical information in the country. The Ghana Statistical Service have been operating under a law which was enacted in 1985 and has recently been reviewed, and we have the new act that was passed in 2019, that is Act 1003, that gives the National Statistical Office a greater mandate for the coordination and also ensuring the proper protection of individual data. Because of the mandate of collecting data from individual people and institutions like companies and others, there is the need for that institution to have a reason to build trust and work with people the way it should. I have been working with the Ghana Statistical Service for 21 years now, and I've worked through several of the regions, and I'm at the head office. And the work I do involve collecting data from individuals. And this is why I see this to be a very important occasion for us to discuss this. And especially in the background that Ghana is celebrating our independence today. Yes, thank you. So it is very important for us that we look at this issue and see how we have been faring. Thank you.
Thank you. Gachara?
Thank you. It's evening here in Nairobi. I'm tuning in from Nairobi. So my name is Gashara Irura. I've been, working with the Open Institute. We are very passionate about citizen-generated data. We are passionate about working with communities at that lower level. It began, in a conversation in 2016 where we thought development has always been driven top-down. It's always been driven from central to the communities. Kenya is new to devolution. I know in Ghana, you've had it for a number of years, but for us, really, it was a lot of things were centralized. So when decentralization happened, we still saw development is coming into the rural areas from Nairobi. So we were interested in, how do we work with citizens directly to get them to appreciate information and data, build data literacy skills? Can they use information to bring about change, either by external or even within the community? Like if there's a problem with waterborne diseases, some of these interventions, they do not require government to step in. So we are really coming in as Open Institute from that place, but then increasingly, again, being aware of our environment and what is happening around us with regards to data rights. And, can we also find a technical, a legal, and a moral solution to the issue of personal data, so that then we are not part of the problem, part of the perpetuants of the problem. And then this is increasingly so at this time of COVID, where contact tracing is happening, where we have to increasingly work at home, or we have to order things online, or we have to work remotely, and a lot of information by virtue of this is being digitized and collected. So I'm glad to be here. I'm glad to also be here to learn, to listen, and also to share our views and our experiences, because also we've been doing some work on data rights. Thank you. Back to you.
Thank you. Thank you. Wale, kindly introduce yourself and tell us a bit about your organization as well.
Thank you. Structure and demographic data for development, which kick-started in Nigeria and fastly extended to a lot of other African countries, which includes Mozambique, Zambia, South Sudan, the Democratic Republic of Congo, and a lot of them. And the goal is to enhance and ensure that data is being used to inform policy directions within these countries. FlowMinder is channeled with a mission to enable access to data that can transform lives and ensure that decision makers are being able to utilize this data to ensure that no one is left behind and everyone counts in the quest for development across the world. And at its core, FlowMinder develops solutions that ensures that people can use data from across the world for development purposes and also for humanitarian interventions. With this background, it's rightly so that FlowMinder is involved in this conversation that revolves around data, particularly as it involves how we can channel the use of data to curb the COVID-19 challenge that is being globally faced. And in some of our projects, we're currently doing some efforts in that direction, and I'm here to actually learn and also share some of the experiences we've acquired along the way. And it's a pleasure to meet you all.
Thank you. Thank you, Wally. So I think that I just want to delve straight into the conversation, right? We are saying that COVID data should be made open. Should it be made open or kept closed? But I really want to hear from each of you. When we talk about COVID data, what are we talking about? Because from my layman perspective, sees a wide range of data that can be used that is being used. Of course, there's the issue of collection of data for purposes of contact tracing. There's the issue of collecting data for purposes of thank you, Wally. So I think that I just want to delve straight into the conversation, right? We are saying that COVID data should be made open. Should it be made open or kept closed? But I really want to hear from each of you. When we talk about COVID data, what are we talking about? Because from my layman perspective, sees a wide range of data that can be used that is being used. Of course, there's the issue of collection of data for purposes of contact tracing. There's the issue of collecting data for purposes of economic planning and for purposes of providing, access to services to vulnerable and vulnerable groups and communities and all of that. So when we talk about COVID data in this context, what are we talking about? Umar, I want to start with you since you work with data.
Yeah, COVID data. Well, COVID was something that we all were not expecting. It came to us, the global community, as something that we were not expecting. And often in data compilation, you look at a phenomenon and you look at the areas or the kind of data that you need to collect that probably would help you to either monitor the process or to kind of inform some policy directions. Now, with COVID, you realize that many countries were taken by surprise. And so the data collection on COVID started without a structure. So countries were collecting data, but then by the day, then new issues emerged, and then they increased the number of variables or the number of items that the data are collected on. So when we talk of the data around COVID, there's quite a lot of data now as a time. Well, from the time COVID started and now, you see that there are a lot of millions of data points that have been collected across the world. Data ranging from who the individual is, the name, the age, the sex, the location, travel history, medical history, in some cases, even geolocation, okay, data. So quite a lot of data is collected. And in all this, different uses are put to all these data. And of course, now that we have the vaccine rolled out as well, some additional data is collected. And in all these cases, you see that the data that is collected have different uses and by different stakeholders. And so generally, I want to believe that in the next couple of weeks, in the next couple of months, we would even be seeing some additional information that will be collected that is not previously collected on COVID, because we would be confronted with some situations that we need to know much more about the COVID. And so it's a dynamic situation and a lot of data is collected. So when we talk of the data rights, we talk of making data accessible and available, then we need to speak about what kinds of data need to be made available, what kinds of data need to be made accessible, to which categories of persons or institutions, because it doesn't make sense to make some of the data available to some people who don't even know the use of those data. And so in that context, a lot of data is collected. And now almost every country has so much data on COVID. As to how much of this data we can make available or we can make accessible is the issue that we'll be delving deeper into.
Thank you, Umar. I am coming to you, Gachara. What are we talking about? COVID data, what is that? I know Umar has thrown some lights on it, but I would really love to hear from your position, especially looking at the work you do and making data accessible to the grassroots. I really want to also understand from your end, what do you see as COVID data?
Okay, thank you. Thank you for the question. I look at it like from two perspectives. Of course, we didn't anticipate COVID, you know. Then COVID happened, and COVID has manifested in two ways. It is a health issue. It is also a socioeconomic issue. So when it comes to health, then it is sensitive because this is something new. We do not know what it is. The stigma around it. And so all these are data points that are really, they are really sensitive. I remember I had to get tested once. Of course, it's an anxious moment. But when I was going to test, like somebody I know came to the clinic when I was there, and I said, I'm actually testing for COVID. And I could see and he's my neighbor because it was near home. So I could see he was like, okay, that he put on a serious face. And that kind of tells you the sensitivity around that information. So of course, it being a health issue, these personal records which are collected, but it also being a pandemic makes then this a public health issue. And when it's a pandemic, then the government steps in. The government has to have some measures, to protect us in spite of ourselves. So then we have to look at it in that way. That there are some personal records being collected. They have to be stored somewhere. Some of it has to be collected without our consent. When you do a test, information is collected and you do not know where it goes, who uses it. You are monitored whether you left the house, if you should be quarantined, but you left, through your mobile phone, for example. And it is for public good, it's for the greater good. And this sort of information is what is unnerving, because then we ask, can this information be used in a purpose that is not COVID related, yet it's of a very personal nature? Can this information be shared with third parties without our knowledge? Like now in East Africa, I think when you're traveling out and you test, all the certificates can be found online, for example. You'll access yours, obviously, but they are shared across countries, because where we live, people are making their own certificates so they could travel. So again, that is personal records, and in that particular sense, from my perspective, I will answer the second question a little bit as I talk through. Should it be open? I believe not, because of the sensitivities of it. However, it being an issue of public good, citizens have a right to know. They have a right to know what is happening. They have a right to know, for example, how many infections were there today, what is happening in my locality. Here in Kenya, for example, kids have gone back to school, but the ministry says they will not allow parents or even the media to collect that information or share that information or speak to the press in any way about the incidence of COVID in schools if they occur. So then I put it on a spectrum. because the aggregated information that is not of a personal nature, I believe then that should be shared out, because people need to know. It's because when you know, when you have the facts, then you can take action. Yes.
Thank you, Gachara. Wale, what is COVID data?
Okay, so it's difficult to come last and speak about similar things that previous speakers has already articulated on. But just to chip in my own perspective, COVID data can be looked at into two dimensions: the health dimension and the socioeconomic dimension. So COVID is something that has changed the way we live now. Is changing how we think about things and how we operate on a day-to-day lives now, our lifestyles now, and things like total number of cases, total number of recoveries are already publicly available in some public domains and things like that. And really, we should ask ourselves that in order to answer the question of should COVID data be publicly open or closed, we should ask ourselves, what is the benefit of making this data open or closed? And really, it will trickle down to how do we intend to leverage the use of this data to help or to potentially mitigate the spread of the virus itself. And if we can look at it from that perspective and that dynamics, we'll begin to realize that the data itself should be categorized in different dimensions. There should be some data that should be publicly available, such as counts, and there should be some data that are anonymized but also available, such as geographic locations of numbers of spread of cases, and also things like the effect on schools, health facilities, communities, and how those are affecting their ways of life. Those data should be publicly available as after being anonymized. And there are some personal informations that definitely should not be made open. That's a standard policy in terms of privacy. And if you look at across the world, there are a lot of laws that protect making private information publicly available, such as GDPR, the NDPR, and things like that in different countries. So we need to all look at how the data itself is going to be utilized before we can actually answer the question if the data should be globally opened or closed.
Thank you. I know that at the global level, at least with COVID, there's been some kind of data which is being shared in the different countries, just to know, the nature and the spread of the disease and how it's spreading in countries. Omar, I just want to come to you on this. So I'm going to ask the real question that we really have to answer here, and please feel free to move to and fro from it and delve deeper, because this is a very big issue. I don't think our simplifying it will solve the problem any better, but I still have to ask it all the same. Should COVID data be made open or kept closed at the global level? And what will this mean for access and use of such data by African countries? We're all within Africa. Umar, you work with the Ghana Statistical Service. To what extent have you had need of global COVID data? To what extent have the global communities also had the need for you to share local data within our communities? Is it very important that in tackling this pandemic, we make this information open? And if so, I'll come back to the question Walu asked, what kind of data should we be opening up?
Yeah, thank you. And I think this is a very broad area that we are looking at. and taking from what Gachara has indicated, when we talk of COVID data, I want to look at it from three clear perspectives. Now, the case data, because all of these are related to COVID. The case data, where individuals who come into contact with the virus and how they are treated, whether they are tested or not, whether they are positive or not, whether they are quarantined or not, and all the others, and whether the person recovers or exits, expires. Now, that is one angle of it. Now, there is the other data, which currently we have in, which is the vaccination data, where we're looking at individuals, whether they have COVID or not, are taking vaccines. Now, what are the effects on these individuals? A lot of data will need to be compiled to understand, one, the efficacy of the vaccines themselves, two, whether there are some reactions, some people react to these vaccines or not, and among others. This is another set of data that is also COVID related. And the third set of data that is COVID related is the effects of COVID on individuals, households, businesses, and the economy. This is also COVID related because COVID is not just the health issue, as Gachara said, it had a socioeconomic issue. So the effect of it as well is another angle that we look at. So if you want first to look at it from the perspectives of Ghana. So first, we working with the Ministry of Health, the Ghana Health Service, and all the partners collecting data on the cases that is used directly to intervene, and we are very popular with the series of the president, coming to our homes, right? Good. And I think the president's interventions from the very first time we had COVID on the 16th, on the 12th of March to today have largely been informed by this. The second aspect that has also been informed, that these interventions have been informed by, is the socio-economic effects of COVID. Okay, and so in the case of Ghana Statistical Service, for instance, when the Ghana Health Service was putting the COVID data out, we went ahead to provide some additional information that might not be seen to be directly related to COVID, but that are very important in understanding the spread of COVID. And that is, what is the proportion of the population who are 60 years plus in all the districts? What is the proportion of the population or households that have recently reported that they don't have water and soap at home for hand washing? And what are the locations of health facilities, to the extent that people can have easy access to health facilities when they need it? Then, beyond this, we did what we call the 3 trackers, tracking the effects of COVID on households and on jobs, the effects of COVID on businesses, and the effects of COVID on the local economies. So we did all this as rapid assessment to understand the effects of COVID on the individuals, whilst these other ones, and these largely inform the interventions that we have received from His Excellency the President. And as Wale mentioned, then we had the mobility analysis that we did with FlowMinder that seeks to understand the pattern of movement of people across the different parts of the country that will also inform these issues. So largely along this frame, you realize that we have different kinds of data. Now, if you come to data sharing within the country, first within the country, within the continent, and then we look at it across the globe. Within the country, you realize that because it is something that hit us unexpectedly. Yes, there was a strategy that was adopted in how we handle it. But you ask me, and I will say that even data sharing within the country has not been consistent in a way that would give us all the information we need. And it is because sometimes we do not have a framework that gives us a sense of what data is available, who is collecting what data, and who is responsible for what. So in that respect, you realize that we are somehow restricted in how we're able to use that data and share it within the country. Now within the continent, you realize that every country and every government was approaching it based on the knowledge, the local knowledge they have. And so first and foremost, the attention was, how do we deal with this within Ghana? What can Ghana do to protect our citizens? Even before we think of how can we help the citizens of my colleague in Nigeria, right? So these were some of the initial considerations. But then you realize that we are all in a global community where the interactions we have through the different frameworks allows us to share data already. And so as we do this, these were also happening. And for that reason, we started having knowledge sharing around, for instance, in the case of Ghana, we were one of the first countries in Africa to develop a COVID data dashboard using the geospatial platform. And so quickly, the UN Statistics Division reached out to us and said, look, can you share the knowledge with other African countries on how to do this? And I recall colleagues from Statistics Nigeria, the Federal Statistics Bureau of Nigeria, reached out to us. And so there were some engagement around sharing knowledge in that respect. At the same time, the institutions from the health service that are collecting this data already have framework of sharing this data with WHO, with the Africa CDC, among others. So there's this kind of data sharing arrangement that is already going on to understand the magnitude of a problem on the continent. And once this is shared within the continent, it is also shared across with other countries. Now, coming back to your question about whether we should make this data open or closed. To some extent, the data is open. To some extent, some data is closed. Now, the data that is open, but not open in the sense or in the framework of open data. It's only open and available and accessible to people who understand the data, who need to use that data, and who actually have the
capabilities,
the mandate around this data.
Okay.
Now, this data, yes, it is important to make this data open in the sense of open data. Why? Because there may be other expertise. There are other people who would also be able to use this data to provide some additional layers of information that maybe these other institutions that have the mandate don't have. But we have to look at it from several perspectives. And I want to draw the analogy with, for instance, HIV. Okay? Because you realize that governments have a responsibility to ensure there's no backlash from their populations. Once you make the data available, what are the issues that people are very much concerned about in making this data available that would injure others? And so government would have to critically look at it and say, okay, this data, we cannot make this part of the data available, but these other ones can be made available. And I'm raising the issue of HIV because some people got to know the status of some people and they were stigmatized. And now many people didn't even want to get tested or declare their status. And these are some of the things that would have to inform us in this area. The second thing that I want to focus in is, now in making our data available, do we have the institutional infrastructure, institutional skill sets, the capacities, okay, to utilize this data? This is another area that we would want to discuss on this platform, because it is one thing making the data available, is another thing using it appropriately, and also the necessary safeguards to ensure that the data does not end in the wrong hands for it to be misused. So these are all the issues around this. I'm sure I may not have touched on all the issues, but then we will still come back to it. Because for me, Open, yes, we need to open, but not all of it. There are some data that you don't have to open. Two, we need to make use of this data, and there should be feedback system that allow people to know, or countries and the populations to know that these data about us that have been made available, these are the benefits that we are deriving as a result of the data being made available. That way, you realize that the backlash around misuse of data would be minimized. So this is how I would want to approach it.
Thank you, Ma. That's very comprehensive. Wale, I'm going to come to you. You work with FlowMinder at the global level. And so looking at these, let's move away a bit because Umar has shared more experiences like with data within our respective countries. You work at the global level. To what extent has the information or the global data on COVID-19 been made open? And, should it, if it has not, should it, or should we start thinking about it? And what would that mean? Or what if it's closed or is partially open? What does it mean for African countries to have access and use such information?
Okay, thank you, Teki. I think Omar has mentioned a lot about the dynamics of data being open or closed, but I'll look at it from the perspective of data should be classified based on relevance, particularly COVID-19 data. And really, if we look at it from that dynamics, there are some data that should be publicly open. There are some data that should have limited access. And these data can only be shared with specific organizations, and appropriate legal or data sharing agreements should be made, should be established before those data are shared. And depending on different countries and different contexts, there are some data that might remain closed. So if we look at it from those three classification, we can start having conversations around which data are actually currently open, publicly open, which data are limited in access, and which data are closed. So, for example, case numbers are data that are publicly open currently, and dashboards like the John Hopkins dashboard that records a daily track of cases globally is publicly available for anyone to actually take count or track or keep updated on the number of cases globally. And this has been very helpful to a number of countries in ensuring that they compare the cases across different countries and different contexts, and also put policies in place to ensure that they guard against entries and exits from different countries, that depending on the numbers of cases in those countries. And there are some data that even on the case data, they're still part of those case data that cannot be publicly available, such as geolocations of the cases that are being recorded, the health background or previous health conditions of particular persons that are tested, that test positive, and things like that, personal information that are being recorded while COVID-19 tests are being conducted. Those data are not publicly available. What we get to see are mostly the counts of COVID-19 cases across the country. And we go down to what I call limited access data. Data that have just limited access. That's when we start talking about more personalized data, such as previous health histories, geolocations of cases to try and do contact tracing, track community spread of COVID-19, and also try to understand how the virus is spreading within communities, within localities, and within countries. This data has limited access because it's not everybody that gets to see this data or have access to this data, but specific organizations that have a particular focus on the utilization of this data. And depending on the context and the specific countries, these data are made available to those persons based on established agreements within the specific Ministry of Health and the organization requesting the data. I'll give you an example. So in Nigeria, we were working with NCDC, National Center for Disease Control, particularly in trying to track the number of cases across the country. And we had to go through, under the Grade 3 partnership, that's the georeferenced infrastructure and demographic data for development, we had to sign a kind of data sharing agreement that allowed us to get access to the geolocations of cases within the country so that we could support the government in trying to perform some geospatial analysis to help track community spread. And that's a very perfect example of those kind of data that cannot be made publicly available because they are very sensitive. And unless specific people that actually are aiming to utilize those data for specific solutions to support the fight against COVID-19, there is no necessary need for those data to be in public domains. And there are some data that, depending on the countries and the context, might be considered as classified and remain closed. I don't have any specific example that comes to mind right now, but I believe that those those kind of data exist. And if we look at it from a global, if we look at it from those three angles, COVID-19 data currently, some of them are publicly available in the public domains, and such as the case numbers, probably aggregated to administrative boundaries, regions, countries, and things like that. And definitely organizations like WHO have access to more detailed information such as specific locations, health histories, and other things like that. But I would like to touch on some auxiliary data that could also support the COVID-19 fight that Umar mentioned slightly during his talk, such as the population data that could support to try to give insight into potential areas where COVID-19 could spread more rapidly, such as we in the early days of the virus, we were made to understand that people above the age of 60 are more prone to getting infected, and those kind of data sets, though in terms of counts, again, in terms of count, should be made publicly available. But for example, under the Grade 3 partnership, we release data that are very high resolution, that are up to 100 by 100 meter grid cell. And really, if you begin to look at these data sets, you can begin to try to understand the age grouping of people within localities. And immediately you start looking at that granular picture of data. There's a privacy concern that comes into the picture. So there's always a balance. There has to always be a balance between what is in the public domain and or what has limited access, because till date, because the COVID-19 started in the Asian country, there's been a lot of bias to Asian population in a number of countries, and these are some of the vices that availability of data could potentially bring about, and we have to always, in the use of the data, guide against some of these negative implications.
Wale Gachara, you have the unfortunate task of finishing off, where they started. But yes. I'm coming back to you, and you can still touch on briefly on what they also spoke about, looking at whether the COVID-19 data should be made open or kept close at the global level. But I would also want you to throw a bit more light on whether, from your perspective, the implications of making the data open. Clearly, we are quite clear that some of the data has been kept open, some have been closed at the global level. But do you think that, these, whether closed or open, leads to Africa's equitable access to crucial data. It leads to equitable access to maybe treatment of COVID-19 cases. And then even now, our biggest issues that has to do with access to vaccines. And when you're talking about vaccines, for instance, there's of course another level of data on development of these vaccines, and whether or not, you know, Africa should be just be given the vaccines, or you give us the data that goes into development of these vaccines so that we are able to develop our own. So do you think that, especially in the area of what Wally calls sensitive areas where the data need not be made closed, do you think the full closure of these data and not making it accessible to Africa really puts us at a disadvantage?
Okay. Okay. So big questions. All right. So I will take us back a little bit, and I'll speak as an African. When COVID rolled out beginning of March, then we saw all the numbers in Italy. Then we were preparing for the worst. We were actually preparing for the worst. But then as time goes on, like as of today, if you compare globally, maybe we have 116 million deaths globally. Only about 2 million are African. So there's been significantly less, unlike Ebola, unlike HIV, there's been significantly less incidence of deaths, even infections. There are more people who are asymptomatic. Now, what has that meant for us at the policy level? I would say this is an assumption, but there hasn't been a concerted effort. Of course, we have local research institutions that are doing a lot of work to try and come up with local solutions. Like in Kenya here, we have Kenya Medical Research Institute, and they have been working on vaccines, you know, from malaria to even COVID, because they were really held up and they were trying to get a solution to this. You know, speaking specifically to this particular issue, in terms of research at the global level, I think there was an article that I read on Tuesday that was saying like only 4% of global research on COVID is coming from Africa, but Africans comprise 17% of the global population. I do not want to correlate it to what I began by saying that we have less people, we have less deaths, we have less infections. Every life matter, but also when it comes to that, how it would manifest, there are a lot of factors. There is the resourcing factor. There is the ratio of doctors to population, etc. But our initial concerns, people stopped, they put brakes a little bit and stopped pressing on the gas pedal and said, maybe it's not that bad after all, and which is a laissez-faire approach to the issue, because then now there are vaccines, and the issue of vaccination comes in, and what we might begin to think returning to normalcy, because whereas health-wise maybe we have not been so afflicted, socioeconomic issues come up. So now at the global level, what are the two key issues that I see in relation to the question on equitable access to treatment? I will start with the first one, which for me is key, is the issue of a lack of, like 4% of global research, like out of 2,000, closely 2,196 papers on on COVID, like research papers, you find that only, about 90 something are relevant to COVID. I think that is wrong, because then it means there's no body of research on the continent, even as we move to kind of try to tackle these problems of whichever nature which they may be, whether from health or the socioeconomic. That is one. And then also because there's such little research here, I also believe then, I come from the school of thought of thinking through research from an open perspective. I've recently been convinced that you should be able to not just publish information or research on journals, that when you open up your research to others, specifically your data, then somebody else is able to pick it up. And this is part of the fair principles of open science and open research, where people can share their findings and people can build upon that particular finding. So, and it's really, really drawn from the other principles of open data. I think that would be good. Of course, there are issues there, of course, and Wole has touched a little bit on it. There is some information that is public, and there's some information that is private. There is information that is institutional, and the private information touches a little bit on intellectual property rights. So I've developed a vaccine. I need to make money, recover my investments. Okay, but people volunteered to be tested for this vaccine. In all honesty, they are not all your employees or all your relatives, for example. So,
Gachara, are you there?
Yes, I'm here. Can you hear me? I can hear you. Can you hear me? Did you lose me? Can you hear me?
I can hear you.
Okay. I think we lost Teki. Yeah. Okay, but I will proceed.
I think you should proceed.
All right. Okay.
Yeah.
All right. Okay. So I was reflecting on how the vaccine has come to be, and that people have people have participated in it. Of course, then the research tells us it's been less of Africans on paper or on the research. Take you back.
Yeah, yes, I am.
All right. So I'll proceed. So I was saying people have either participated as subjects to research, and so they have contributed to this body of knowledge. But also some of the principles of open research tells us that the collection of this information and research, it can be accelerated, especially now that we are facing a pandemic. I think this is not normal. I think that in as much as governments also are able to invest in research, it's not just private money going into research. I believe that the seek for a vaccine should be a public good. I always believe health is a public good that should not be sold to the highest bidder. So that being said, and coming back to where we are and contemplating the issue of vaccines, I think that Africans should find a way to finance, and there's also conversations at the AU level how we can finance purchasing of vaccines, and also how we can work together to try and get the costs down, because of course it is not going to cost nothing, but we need this treatment. And I feel that it is important for the AU to kind of think about this issue and move together and speak with one voice when it comes to this issue. But then also there has to be a financing part, because that is, we have to find a way, because we have to pay for it, obviously, but we have to find a sustainable way, because also we cannot we cannot. As I said, it is a pandemic. It's a health issue that requires a public response, not one that looks at the highest bidder or the person with the most amount in the pocket, and which is what the West has done. They have kind of snuffed up all the vaccines. And then my last issue, it's kind of unrelated, but it is important to this conversation. Is going back to the socioeconomic one. So we've equitable access to COVID-19 and looking at Africa and where Africa is placed. One of the things that were severely disrupted is the global supply chains. And I'm thinking of trade. Of course, from where we sit, it's been said like Africa does like close to 2% of global trade. So that presents a problem, but it's exacerbated by COVID-19. A lot of the produce or the things that we maybe use, maybe they come from China, or they are inputs to our own manufacturing processes. A lot of the supplies that we need to deal with COVID-19, like masks and PPEs, they might be coming from China. And this was coming to my mind as you were just thinking about how we think or how we perceive data being made public that is relevant to COVID-19 at the global level. Because I think these are some of the issues we should continue to talk about. Because then when we're thinking about our own supply chains or our own manufacturing or our own people staying in employment, then we have to think of this disruption that has happened and how can we use that data to say, actually, we want, fairer practices of trade, not just when it comes to this vaccine, but also when it comes to some of the other issues that, have costed like people livelihoods. You didn't know that, if flights were disrupted for 2 weeks, then you actually will completely lack inputs to your own manufacturing processes, such that then there's a better think through of supply chains. There's a better think through an advocacy, even at this global level, on why we need fairer practices when it comes to trade. Yes. Back.
Thank you. Thank you, Gachara. Wale, I'm coming to you with this question. So in all of this, of course, if we're looking at data sharing in any form within countries at the global level, data sharing agreements and policies play an important role in all of these. To what extent would you say that, at least when you look at Ghana, or which I'll come to when I'm talking to Omar, but if you look at Africa and looking at the work that you do, Wale, do you think that we fairly have in place these protocols, whether they are data sharing agreements or COVID just caught us unawares and forced us to essentially create systems that allowed us to share data. So whether there are other policies or agreements, how have we gone about this so far? Are these in place, or it has been a real challenge in ensuring that we're able to effectively share?
Okay, thank you, Taki. I think that's a very important question. Before COVID, I know a number of African countries have signed up to the open data policy that has been enacted by the United Nations. And to a certain degree, some countries have started opening up a lot of their administrative data and general specific data around specific sectors. And also, just to mention, the georeferenced infrastructure and demographic data was also built around integrating and building a platform where all data within countries could be warehoused under one platform and made accessible, publicly available to persons and individuals that could leverage the data for research and also preferring solutions to different specific problems. So I think there's been a lot of effort towards trying to open up data within different countries in Africa. The levels at which different countries are or were before COVID might vary, maybe slightly or largely, but I know that there's been some efforts in that direction. And COVID met us in a very big surprise, and we saw a lot of countries, not only African countries, we saw a lot of countries struggling to keep up with the speed at which COVID shook the whole world, and rightly so. What we experienced was that countries that already had some of these structures in place were able to quickly utilize those mechanisms to make data available and accessible to specific people that would leverage those data to inform solutions that could help them in the COVID fight. There's what we call the national geospatial data infrastructure. Nigeria has one. I know Ghana has something around those lines, and a number of African countries have similar initiatives. And basically, what that does is it ensures that geospatial data that is being produced within the country is warehoused within a singular platform and made available to either government agencies and development organizations to utilize the data, or made publicly open. And so some of these frameworks were leveraged very heavily during the early days of COVID to try to curtail the spread of the virus. And definitely there were some new additions to the block, which was geared towards opening up some additional data set that would be valuable to support the COVID-19 fight. One of them is, I'll talk about the one in Ghana, the mobility analysis that we worked with GSS and Vodafone Ghana to potentially support the Ghana government with. In the early days of COVID, there was a framework that was already established, and we rode on those platforms to ensure that timely information around movement of people within geolocations and regions were provided to support analysis around the spread of the virus, and also there were new data sharing agreements that were established, MOUs that were established between intergovernment and external organizations that wanted to support specific governments in performing some analysis that could support them in various interventions. So definitely, we are not yet where we should be in terms of having those systemic infrastructure for sharing data with ease. But I think COVID-19 has woken us up to the reality that we need to have some systemic processes in place to ensure seamless flow of data, both within government agencies and also within government and private organizations, and definitely more widely to the public.
Thank you, Wale. Umar, I just want to come to you here. You have worked with the GSS throughout this period. Do you want to let us know whether you think you have in place adequate frameworks that facilitates sharing and making data accessible?
Well, to start with, I would say that has been one of the big challenges within the statistical community on the continent. For instance, if you look at the Cape Town Action Agenda that emanated from the the World Data Forum in 2017, one of the main reasons of the underdevelopment of the statistical system on the continent, for that matter in the global south, has largely been the uncoordinated way data producers within the same country operate. Now, in this context, if you take it in the case of Ghana, and I have raised this in several fora, that you cannot seek to own what you do not invest in. And a lot of African governments actually play lip service to data production and utilization. To that extent, you realize that the interconnectedness that we should have in data systems within the same country do not exist. For instance, one ministry A wanting data from ministry B, and it has to take an individual making a request to another individual from ministry A and ministry B. And how is this data shared? It is either shared by taking a memory stick there to collect the data, or through what do you call it? Email system. And when you have that kind of system existing, it becomes very challenging in terms of the current situation that we have to share data. Because when we are dealing with data sharing, there are some fundamental infrastructure needs that must be available. And let me tell you this interesting story. Now, as part of my job in coordinating the data ecosystem for SDGs in Ghana, then we realized that there was the need to get some indicators computed around goal 9, okay? And the data will have to come from the Ministry of Tourism. So I requested for an engagement with the directors within the Ministry of Tourism and the Immigration Service, because part of the data will have to come from Immigration Service. And in that conversation, it's very interesting that the ministry made a request to the Immigration Service for some data on arrivals and departures. And Immigration Service went to the ministry to do an assessment of the institutional arrangement to receive that data. And they told the ministry that, no, your security system is not adequate enough for the data. And you know what happened? The Ministry of Tourism actually went to burglar-proof a particular office with the expectation that that is the security system that was required, only for the Immigration Service to come there, look at it, and they went and never came back. And so they never communicated anything to them till the day we convened this meeting, that it came to light. So I told them, no, when they speak of the security, they are looking at something completely different. So when for the ministry, for instance, was requesting that data, did they have the expertise within the ministry to understand what they were even requesting for? No. So these are some of the things that I think that one of the main things that we are lacking and that we need to look at critically is the infrastructure requirement, the data security systems that are required. Well, like this project we have with FlowMinder, for instance, and you in particular, you are very much aware of this because you really put us on our toes to make sure the right things were done. You know, when GSS went into the agreement with Vodafone Ghana to access the CDR to help compute some quick indicators, we didn't have the infrastructure at GSS to receive this data. We didn't have the skills. So we have to work with FlowMinder. And so FlowMinder have the security systems in place that they are allowed to go remotely into the service of Vodafone to take out the aggregated data, anonymized aggregated data. GSS doesn't have it. So in line with this, so what we have tried to do is to engage a consultant to come and do an assessment of the institutional IT infrastructure that exists now and the security system. Because the idea is to make sure in the next couple of years, months or so, we should be able to access the data directly. So even with us, who have been producing data since, the first post-independence census was in 1960, look at it. Our even structure is not right for that. Another typical example is before the current act of the Statistical Service, Act 110 of 2019, we're operating with PNDC Law 135 of 1985. Now, the only MDA, an agency of government that had a direct recourse, the law establishing that institution has a direct recourse to the National Statistical Office, is the Birth and Death Registry, which was previously part of the Statistical Office and then later on was separated. So they were mandated to submit their data directly to GSS. But ask me, how were we taking this data? We have to take a memory stick there to go and take that data. So you can imagine. So with the current system, what we have sought to do, one, to get the institutional framework set. And so the new law has made it mandatory for all line ministries to work with the Statistical Service and share data. Now, the law has been passed, Parliament has passed it, they are done. Now we will have to make sure we put in the necessary security in place. And so what we are doing now is set up a data pipeline that will have all the security needs. So that, for instance, when the birth and death collect data on birth, death, and all that, they just click a button and that data, they know the variables of interest to GSS. They click a button and directly that goes into the server. And it's only some people who have some, what do you call it? Clearance, who would have access to the data. But then they would be able to turn the data, anonymize it, and make sure they remove all the identifiers before this data will be put in a pool where other staff can have access to that data and use it too. And so, even with the statistical office, if we have this challenge, then that tells you that in the whole system, it's a big issue, and not just for Ghana, but across the continent. And this is one of the important things we need to care for.
Wow, wow. Umar, you're making me feel as if we're even talking about the wrong things. So maybe before asking the global to give us data, I should have started with, is our home in order? Are we ready to even receive all this data? Because clearly we are talking about access to data, but if any global is even ready to give us the data, and from what Wale said, I believe the data is already out there and it's accessible, but are our institutions ready and capable of accessing that data? Gachara, you were bashing everybody to open up. I'm coming back to you. So clearly from what Umar has said, there needs to be a lot more beyond the data sharing agreements, beyond the policies. There's also the need for infrastructure, that puts us in a place where we can access the data in a way that can be utilized effectively. Are we really ready to have this conversation? And for those of you who are joining us on Zoom and online, kindly put out your questions. It will be shared with us. I've seen one question already here. So Gachara, let me come to you. Are we ready? You've been bashing somebody to make data available, but are you ready to receive the data?
Yeah, I think it's a yes or no question, but it's a very relevant question. I think as Omar has said, even from Cape Town. One of the biggest issues is underfunding. One of the biggest issues is underfunding. I don't think it's because these things cannot be done. I don't think it's because we do not have skills. Like, people can learn very fast. I remember some time back, I had the privilege of working with what is it called? The guys who are responsible for aid management, the budgets at the ministry, at the treasury in Ghana, Ministry of Planning, and
Ministry of
finance and planning. Yeah. And I think within like 4 or 5 months, the guys had picked up the skills, and the guys had worked within the system to know what needed to be done in terms of mapping out what the projects are and how they were funded. So I think capacities can be built very fast. I think there's two things, because it's issues of money. Even in our own projects, in our own organizations, even when we're writing a proposal, when we ask the donor or somebody, or we rely on the donor, say we want to fund the data collection or the M&E part, they are normally averse to it, but that's what needs to be done. So we have to come up with innovative ways to finance this infrastructure that we want, because we need it. And I think also it's time that we begin to consider collaborations in terms of how do we work? Like, the example that is here is Flowminder is there and is working on a particular project with GSS. From our perspective here in Kenya, I've seen some development partners also going to KNBS, and not just financing, like we want to do the demographic and health survey, but we actually want to do some institutional strengthening in a particular area. We also wanted to do some similar work, like there was support to do some similar work to look at SDGs from the perspective of CDRs as well here. So those sorts of things will build the capacities, but they are able to kind of, open the eyes of the people who are not in the room, who are outside the room, who are in parliament, who are approving budgets. And when, the DG is asking for, we need this budget to do ABC, then it's very clear. It's not just a question of census data and the population and, elections are coming up. I think, as Omar was talking, I wanted to add something else, which is not kind of answering another question. He said, you cannot own what you don't invest in. And I think that is a very important comment to make. I think we need to view it in the context as well of who are the actors in this, who are also trying to collect data and who are trying to bring out certain issues. Of course, from the CSO world or from the private sector, they want to ultimately try to influence policy. So, and specifically now I'm referring maybe to like citizen-generated data and that sort of thing, where if I believe if we are able to use such innovative approaches, because the private sector does it, of course they have funding, but I would see, for example, here in Kenya, the Kenya Association of Manufacturers or the Kenya Private Sector Alliance, they're able to reach out to their members or reach out to their constituency and come up with something that says, we think that this should change in terms of policy. Of course, the private sector contributes a certain percentage of GDP, but they're able to move it. I believe there will be a bigger voice if we understand each other from the perspective of when you are monitoring the SDGs and we find these issues, that we are able to work together, knowing that CSOs have a watchdog role to government, but also there are these findings. could we interrogate the findings? Let's not see who collected this data, but can we interrogate these findings? Because they are telling us something important. And this is very related to you know, you cannot own what you don't invest in. I think it's very relevant because then it helps us to kind of go an extra mile to understand the issue. And I think those synergies can help us or brainstorm or come up with ideas on how to go about financing, you know, financing data collection, financing infrastructure, because some of these CSOs, they operate in very, you know, very resource-starved environments, but they are able to do a lot of work, some of which is bad, but some of which is good. And the good ones we should recognize and then say, okay, how do we scale this? Because they were able to do this. They didn't have $1 million. They just had $1,000, but they did this. Yeah, that would be my comment.
Thank you, Richard. Wally, I'm going to come to you from another angle. So in all of this, of course, we've spoken about the fact that there are different kinds of data, COVID data. We're also aware that there's the sensitive parts of COVID data, and to some extent there are some personal data also involved in the collection. And I'm going to fuse all this with the question that we've just received, which says that, are there published standards that can serve as a guide for compliance with data privacy regulations in the context of open data? Wale, do you want to take that up, and then I'll move to Umar's response on that?
Okay, so thank you, Zaki. To answer that question, I say yes. There's standards and published standards, and you would agree with me that policies like the GDPR and also Nigeria just launched the Data Protection Act, which tries to expatiate on some of these issues around compliance with data, privacy and regulations. These laws and policies are in existence. I think the conversation should be to what level are we adhering to these laws, however limited they might be. Probably they need to be updated or reviewed. In some certain context, I agree with that particularly. But I think that rather than looking at the wealth of policies we already have at hand to set a standard for guidance in the use of data to ensure privacy is protected, we need to consider to what level are the existing policies being implemented. And I say this because I work in a data environment, and you would be amazed at the laissez-faire attitude of some government organizations to privacy data. Probably they are not well informed around the implications of how the negative effect of how this the negative effect of what could happen if these data are not protected and jealously guided to prevent to avert personal information thrown out there. So that's my stand on it, and I think it's important for us to look at it in that context. I can go on and on this because I'm very particular about this, and Flowminder are very keen.
I kind of disagree with you a little bit, but I really want Umar's intake on whether there is guidance, because as far as I'm concerned, and the law especially data protection laws, have never been enough when it comes to practically dealing with some of these real challenges, especially around, yes, there's some initial, you can say some kind of pointer to what needs to be done. But when it comes to actual guidance that really works, helps you navigate how you should handle and process data, especially research data, such as the ones you collect, such as the ones Umar will collect and use. I don't know. I would beg to differ on whether there is enough out there that can really facilitate and especially publish guidance. But I want to, because of Miles in the space and his work there, I'll be happy if Omar confirms your position, but I don't know whether there's enough. Omar, over to you. Let me know.
Let me start with this, probably, maybe, I don't know if it will be controversial, but let me say that there will never be enough regulations out there. And the reason is simple. Open data should always be looked in the context of technology, innovation, and the use of this. Because if you asked me this question about 10 years ago, 5 years ago, I would say yes. We talk of confidentiality when we're collecting data, and so it is enough. And we have evidence to that. For instance, another example is in the 2000 census, there was this European who lived around East Legon who had engaged a household, and apparently he didn't have much information on the household. Then the census takers went there, that was in 2000, went to the house, collected data on the household, and he knows that the census takers also interviewed that household because he lived in the boys' quarters. Now, 2 weeks after the census takers are left, apparently this guy was just trying to understand the terrain there, and so he made away of the properties of this man. Then the man then went to the police, and he remembered that the census takers coming there took a lot of information on him. And so he came to the statistical service with the police that this is the situation, and so they wanted information that could help them to track down the person. And the statistical service say, yes, it's true. We came there, we took the information, we have it, but unfortunately, we are not making that data available to you because by law, we cannot make an individual's information that was collected for the purposes of statistics and research available for criminal. So we cannot make that data available to you. Now, at that time, you understand, we were comfortable with that. But today, we know that even when you anonymize some data, some people somewhere who are so brilliant, so intelligent, and so mischievous will sit down and develop some applications just to make sure they crack and they're able to get. And so you see that this is a revolving environment. But I think there are enough safeguards in place that at least the minimum ones, like Willie mentioned, the global data protection regulations, like the Ghana data protection law and all these other ones. But even in the face of these ones, you still need to continuously put some safeguards in place. And another example is when the issue of we had a COVID in the country in March 2020. And I went to the Minister of Planning to tell him that, look, we have this project on the CDR project that can be used to help to understand the mobility patterns of the population to make it easy for people, for government to understand how people are moving. And so the minister was very interested in that. And he actually referred me to the Minister for Health and the Minister for Communication. But interestingly, what the Minister for Health and the Minister for Communications, they understood this to be that GSS could help with data for contact tracing. And I said, no, the data we are providing is aggregate information on the aggregate movement of people from one district, for instance, to another, from one part of Ghana to another, but not information on individuals. Why? Because it is very dangerous to make this kind of data available, because there's a tendency that people could abuse this. And so these are some of the things. But I want to draw our attention to the Open Data Watch, the Open Data Inventory, for instance. This is a framework since 2015 that help assess countries' openness, how they with data. And interestingly, Singapore is number one. And Singapore has been on top for quite some time now. But interestingly, with the COVID, you realize that Singapore was taking contact tracing data, and they made a public statement that they may be using the contact tracing data for criminal investigations. I hope you understand. So in that context, if you are telling me this in Ghana, how many people will be willing to allow their data to be, you see, so these are the issues. And when you look at the Open Data Inventory, I like it because it gives us a sense of, even as we say we are not so much developed in Africa, you can see that some countries within the continent are doing far better than some countries in the global north, with even open data. So in that perspective, what I will say is that, yes, there are the minimum standards available, but that for me are not enough. So we have to continuously innovate. We have to continuously put some additional safeguards to ensure that people do not abuse what exists.
Thank you so much, Umar. Gachara, I'm coming to you. Do you think that civil society, when it comes to all this information that is being collected, do you think that the public and the civil society are being consulted enough, especially when it comes to sensitive information? So let's look at the context of COVID-19. From where you sit, do you think that the public and yourselves, you were given enough information on the kind of data that is being collected, especially sensitive data?
Okay. Yes. Before I want to answer that question, I wanted to pick up on something Omar said, which I think is relevant to that conversation, and this was basically to do with being it's how policy can be use case driven. Like you come up with an innovation and then you legislate around it. And that is what he's referring to. And I think it is time to think more broadly in trying to answer that question. Like, could we have broad thinking about particular issues? Like when you talk about transparency, for example. Transparency doesn't mean we share personal data, but can we be transparent about methodology? Can we be transparent about when we collected the data? How we used it, who we shared it with, and when. So I wanted to touch on that because I think that is very critical to that particular item which Omar said, because people will continue to innovate. Maybe there will be COVID 2021, and then there's something else that we need to do in terms of then reacting legislatively, which should not be of legislation first. I agree with Omar, absolutely. Now, I've mentioned it in brief. Are we being consulted? No. I don't think. And it's the nature of government. Sometimes government is fast, sometimes it is slow. And the reactions to COVID is the first one was people were in panic. So we were kind of trying to understand what is this. People did not even know how the disease manifested in itself, like what kind of patient care was needed to be given. If you test positive, what do? You are taken in quarantine out of your house. You are taken somewhere and you're supposed to pay for the 2 weeks or the 3 weeks that you'll be there. And then you'll be tested at that time, and then we can release you. And then when your quarantine period is ending, then we test you and you're still positive. Then what do we do? So in that sense, I believe I would see where government is coming from. There's there's might be sometimes they are unable to consult us. Okay, they are unable to consult us. But I also believe that it is so important to be transparent about it, and that's why I brought that notion up. And it is because transparency as a principle means I can tell you, I have collected this about you, just the way Singapore have said. We might use, or we are using this information also to track criminals. I think that is transparency. I think that is what we would like to see more of, because then it is as a person. It is your data rights are human rights, and so we are not being consulted as citizens on the information that is being collected. But I also believe that the CSOs or the non-state actors have to also demand. They have to do their role in telling government, hey, wait a minute. You see, when you do this, okay, it might serve you for 2 weeks or 3 weeks or 4 weeks, but for 1 year it might not. And that's the other issue that happens. I think, when 9/11 happened, there were a lot of laws that were put in place, and America changed, in a matter of weeks. In Kenya here, when we started getting Al-Shabaab attacks, then, we then had to begin to collect data. A lot of data, a lot of personal data when we enter buildings, and it's just entering a building. But then it's 3 or 4 years now, we are still doing the same thing. There might be active threats, and they might be a matter of national security. But then when do we begin to wind down? When do we communicate these things? Even when you're thinking about COVID, when do we say that we will stop doing some of these things? Because I think there is risk of misuse. And that's why I thought of transparency. It's one of the 3 pillars of the Restore Data Rights Declaration. But Tekia will not preempt that in case you wanted to bring it up in our conversation. Yeah.
Thank you. We are about rounding up. I have one final question from Desmond Israel. And anyone who wants to, I'll just throw it to you. As indicated earlier, the tracking and managing of COVID-19 in some cases involve the using of mobile location data. The collection and analysis of such data could reveal users' identities, movements, and associations in a manner that interferes with the right to privacy. Does this support the call for open data practices? If so, what are the best practices recommended? Omar?
Yeah, I've just put some resource in the chat. So colleagues can go to the Open Data Watch, and you'll get a lot of articles that speak to this issue. But it is important for us to balance the need for privacy and the outcomes that we're seeking to derive. And so in that context, it is important that, yes, apps are taking data, information on geolocation, and these are being used. Now, are individuals well informed enough to understand okay, when they're using these apps, do they fully understand the implications of that? That is another area that we need to ask. And that brings me to the issue that our colleague mentioned about engagement with civil society. And this should be an area that civil society become very much interested in and wanting to get citizens to appreciate and understand when and where not to use these kind of applications. Now, the second thing is, what are the regulatory frameworks available to ensure that even as people develop this, even if it is government that is developing these apps and collecting the data, what are the institutional safeguards that we have to ensure that these do not end up being abused? This brings me to the issue of citizen-generated data that our colleague mentioned about. Now, as part of our roadmap to strengthen the data ecosystem in Ghana and be able to provide more timely and locally produced data, citizen-generated data was one of the areas that we have recently piloted. And just this week, we're finalizing the report, which we'll be releasing. And we're looking at two thematic areas, one on gender-based violence and the other on solid waste management. The one on solid waste management on the app, which is called Clean Up Ghana. Okay, the geolocation of waste that is reported through the app is picked. Why? Because the idea is to pick the geolocation of the wastes and get the information transferred to the local government, that is assembly, and then the service providers. And then they know that people have reported that there is waste overpower in this particular location. And so they're able to use that to ensure they go clear it. Okay. Now the other one, which is Let's Talk Ghana, which is around gender-based violence, does not have geolocation. And the reason is simple, because this is personalized experiences that we want individuals to share to have a clear understanding of gender-based violence within our communities. But the data, interestingly, and when the reports come out, you will have almost a quarter of the persons who have used this within a period of 7 weeks that we did a data collection in 3 districts in the country. Persons with disability, almost a quarter of those who reported were persons with disability who have been abused. And these are far and beyond administrative data that we have. And so now in this context and in all these things, we have strategically placed civil society in all our programming to ensure that there's uptake, especially because they will do the advocacy. So all these things bring us to the context that, yes, data must be open, especially COVID-related data. But when there are geolocations that are being picked, we need to be certain that the institutions that are doing this, who own these or who use these apps, have some responsibility placed on them, to the extent that if there are breaches, the population must see that these people are punished in a way that in future others would not toe that line. So that gives trust and confidence, and in future it makes it easy for such applications to be easily adopted within the system.
Thank you so much, gentlemen. We're about wrapping up. 2 hours has come so quickly. So I will be just taking my final round of 1 minute, and 1 minute, 1 minute, closing remarks from each of you. I'll start with you, Gachara, then I'll come to Wale, and then Omar, you can close up, and then I'll give my closing remarks. So Gachara, your final remarks on all these things.
Okay. My comment would be we will need to become a little bit technical as we've said here, we've said, and I mean technical by understand what the issues are from an ICT perspective. We need to begin to think about how do we move away from the policy or the regulations. We've said they might not be enough, and we cannot regulate sectors, to kind of enforce a good practice. We kind of have to also become a little bit more technical and deliberate in that particular area. And then also, I think my last comment is the emergence of machine learning and AI. And I think this becomes a hot topic where we have to think about getting skills that help us to understand what bias in AI could do and the harms posed in there, and how as civil society we are able to then speak to this, because the private sector won't. Government will just regulate. We need to get and understand the issues therein. Thank you.
Thank you. Wale, your closing remarks.
Yeah, so I think conversations like this needs to continue, and we need to involve civil societies, the general public in these conversations to keep articulating how we can leverage the use of data for public good, and as well still ensure that privacy concerns are maintained in this use of data. And generally, I think the last aspect I would think that we should also begin to look into in this conversation are potential capacity strengthening in particular sectors that could leverage this data for public good. And I think it's important for us to not just talk about making this data publicly available, but also talk about providing the right environment, the right infrastructure, the right skill set to ensure that people are utilizing this data to inform policies and prefer solutions. Thank you very much.
Thank you, Uma.
Yeah, thank you. Well, I just want to reassure all of us that yes, the data is already made available, but to those who need the data to make some policies, because I am fully aware and I am part of a team of experts put together by WHO and UN to assess COVID mortality globally. Because if you know the expectation of life, that you can say, okay, this person's expectations of life is this, is seriously going to be hampered by mortality experiences in 2020 and 2021. And so if countries' data is not available to allow UN and WHO to recompute life tables in a way that we would look at the situations where if the world is faced with pandemics, then what would be the model of mortality that we should be expecting and how it will affect the expectations of life. And so these are things that we already know exist. However, to make the data openly available to everyone in the framework of open data, I think we need to tread cautiously, because it's not everybody who needs COVID case data, and it may be injurious to some people. So we need to tread cautiously.
Thank you so much, gentlemen. All too soon. We have exhausted our 2 hours. And I think there's been key lessons for me even here. And one of the key things that came out through all of this is that data is indeed relevant, and there is the need for some data to be open and readily available. But in each of the cases, we have to look at the context, we have to look at who we're giving it to. It also came out clearly that data must be classified and based on relevance and made available based on these classifications. It became clear that even though there are some standards and protocols, there is still the need to put in place, protocols and standards around security, around transparency, around access and use. and putting in place adequate infrastructure to allow us to access and utilize this data properly. And Umar closed us on the fact that when it comes to COVID-19 data, we have to tread cautiously on opening it up because it involves sensitive data and it's not everybody who should have access to this. Thank you very much again, gentlemen and panelists, and those of you who have been following us on Zoom and all our social media pages. ADRH and Open Institute wishes to thank all of you for coming and have a great weekend. Continue to follow us on Twitter at hub_ADR, and then also Africa Digital Rights Hub on Facebook and also on LinkedIn. Thank you so much and enjoy your Friday evening. Thank you, everyone. Bye.